Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi, folks. This is Dr. Virender Sodhi for your favorite show, Your Body is Your Natural Pharmacy. And today I'm very excited to share the thyroid diseases with you because thyroid diseases are very common, and almost 30% of my practice is with thyroid patients. So you can see that there's a lot of patients out there with thyroid disease. Unfortunately, it's not very well diagnosed. If you look at the statistics, around 20 million Americans suffer with thyroid diseases. And the sad part is that up to 60% of those thyroid diseases are not detected, or people not aware of that they have a thyroid disease. Females are around 5 to 8 times more likely to have thyroid problem than the men. So you can see that it's a common disease in the female than in male, although the male also gets it, but 5 to 8 times more common in females than in male. And almost 1 in 8 female will develop some kind of thyroid disorder during her lifetime. So very, very common disease in female. And the treatment is available, but a lot of time the treatment which is available, people are still not doing the best. They are not losing weight. And we will discuss what are those factors, what is causing those things to not function properly, and what causes thyroid disease. Although in modern medicine, allopathic medicine, we say the reasons are unknown, but we have some idea why we get thyroid diseases. And when it's not properly diagnosed, the thyroid disease can cause serious conditions like cardiovascular diseases, osteoporosis, infertility, and many others. Pregnant women with the inadequate hypothyroidism is also an increased risk for miscarriage, and has a severe developmental problems in children. So very important for every female to get screened for thyroid function. And we see a lot of patients with infertility in our clinic. And I remember a case where female has all the fertility programs done, and she has their SWIFT and GIFT and IUI treatment done, spent around $60,000 on the treatment, and still did not get pregnant. And when she came to my clinic, when we checked her thyroid function, that was abnormal. It was slightly abnormal. It was not like a way off abnormal, and it was completely ignored. Her TSH was around 5, and which is on the borderline, and her gynecologist did not pay much attention to it. And when she came to us and we corrected the thyroid function, she became pregnant. So you can see it has a very important role in the fertility also. And another unfortunate part of the thyroid disease is it's a lifelong disease. Although in my clinic, when patient has come to us, if they have come within 1 year of the thyroid diagnosis, there is more than 50% chances of getting them off the drugs. So they don't have to be dependent on the drugs for the rest of their life. So what is thyroid gland? This is the question you can ask me. What is thyroid gland? So the thyroid gland is a butterfly-shaped organ, which is sitting right on your apple's Adam. If you feel your larynx with the voice boxes, and the common name is called apple's Adam, and if you feel on the side, so when you go to the doctor for a examination on the thyroid, usually the doctor will put his hands on that and try to palpate that gland, and this is what the gland is. And it's a very important organ for us, which actually helps the body's functions in many ways. One of them is your breathing and heart rate, your nervous system. It also helps with the body weight, muscle strength, body temperature, your cholesterol, and many, many other functions are done by the thyroid gland. And next to thyroid gland, there are four pairs of parathyroid gland, which is called parathyroid gland, and those has also function in the calcium metabolism. So these, are paired. They work together in many different ways, and also differently in many different ways. So, what kind of diseases a thyroid can get? So, folks, if you guys have any questions, you can call me at 844-301-1250. Since it's a very common problem, and I want to hear from you too, because a lot of people are out there on drug treatments and they still not get, their weight is still on, they still have dry skin, they still have hair loss, and the energy is not there, and there are missing links, which we're going to talk today. What is the missing link there? So if you have a question, you guys can call me at 844-301-1250. So the practically speaking, the function of the thyroid gland is to help the metabolism. Just if you talk one single line, functionality of the thyroid gland. Thyroid gland is the only gland in the body which can pick up the iodine from the food and then combine with the amino acid called tyrosine, and then it's make a single molecule of iodine with the tyrosine. And the iodine we find in our food, very common in seaweed, by the way, like all your kelp and those kind of stuff. Nori, those seaweeds are very heavily saturated forms of iodine. And also, salt is iodized because the iodine deficiency was worldwide, and people used to get goiter, the big gland, which we'll also talk about the goiter in a few minutes here. And so the salt has been iodized, and that has helped a lot of people out there. But still, I think we are not getting enough iodine in our system. A average Japanese eat around 12.5 milligram of iodine a day, and the average American is taking half that amount because they use a lot of seaweeds in their food. Again, everything is a positive and negative. If you're taking too much of anything, that also causes a problem. If you're taking a less of anything, that also causes a problem. So the Ayurvedic science is about the balance. So nothing is too good, nothing is too bad. Everything in the balance. So if you just eating lots of seaweeds, and you can create a problem too. But if you're not adding seaweed or iodized salt in your food, that's also not good. So I think the balance is the key here. So what happened is the thyroid gland gets a stimulus from a pituitary gland, and it sends message, which is through a special hormone, which is called thyroid stimulating hormone. In short, we call it TSH, or thyroid stimulating hormone. And this is the most common measured hormone for the thyroid diseases. So now the thyroid can be hypoactive and can be hyperactive. The most common problem, which I see almost 95% in my clinic, is hypothyroidism, mean under-functioning thyroid. When your thyroid is not functioning properly, that's called hypofunctioning. And there can be so many reasons, and there are so many classifications of hypothyroidism too. But for the general discussion, we'll keep it in simple hypo and hyperfunction. So let's first talk about the hypothyroidism. So what causes the hypothyroidism? It's a very interesting question. And if you look at the medical literature, there's not a very concrete answer available for it. But I do believe that the stress has a role in hypothyroidism. And you can say, what the thyroid has to do with the stress? So whenever we go under stressful situations, we making a hormones which are a stressful hormones. We call them cortisols, cortisol, cortisols, and adrenaline, non-adrenaline. All those kind of hormones are made by the body, and this is a normal phenomena. But what has happened, if you are chronically making that hormones in the body, that suppresses the sensitivity of the thyroid stimulating hormone, or TSH for short, and that causes thyroid to not function properly. There can be a lot of food factors. For example, you're not eating enough iodine in your food or not enough protein in your food. And that can also helps not proper helping the thyroid gland. Also, you may be eating too many goitrogenic food. Goitrogenic food are which has a mostly the mustard family like broccoli, cauliflower, lettuce, even soya products, soya milk. So those are called goitrogenic. What that means is if you eat excessively, that will also suppress your thyroid. So and a lot of people out there who wants to help their body and they're eating broccoli like in pounds, certainly is going to have effect. So I'm not, against using that broccoli or cauliflower or lettuce or mustard green or bok choy, which is all the mustard family plants. But if you have a thyroid issue, you may have to use it care, not to use it too much. And I generally allow that 1-2 times a week. And that, but there are lots of other vegetables which you can use to help the process, like carrots and radishes and spinach and yeah, your jicama, cucumbers and tomatoes. So there is always a trade-off. Not only stopping one kind of vegetable, you can take other form of vegetables. The other pattern is the sleep. Uh, in our current society, what we have done is we are not sleeping properly. We Most of us are we spending too much hours in front of the PDAs and computers or television, and that disturb our balance of melatonin secretion, because melatonin is the night hormone and is the sleep promoting hormone. When you are not helping that process of creating a melatonin, but by not switching off the televisions, your PDAs, your computers, or the shiny lights, your hormone is not going to kick in. And also, when you're stressed out, your body is making more cortisol. When you make more cortisol, the melatonin does not come in either. So this is a very interesting question. So we have now a number of things which can go wrong for not helping your thyroid gland properly. So if you're not going to bed by 10 o'clock and not waking up by 6 o'clock, you are creating a disruption in the thyroid function also. So a lot of my patients who are in IT, we live in Bellevue here and practice in Bellevue. And most of these young folks are IT engineers, and now a lot of them older folks too, because previously 20 years ago, 30 years ago, it was a brand new branch of the technology. Now it's becoming, those folks like me has getting old. And so these folks are up against the computers for several hours. I think average 12 plus hours a day. And I think I'm also one of those, because I'm sitting in front of a computer. I have a cell phone in my pocket all the time. And at least I end up spending around 8 to 10 hours a day in front of a computer. So I have a hypothesis, because these computers, they give off a low level of radiation. Your cell phones also give off, your microwaves also low level of radiation. And the thyroid gland is a very unique gland in the sense that it can be sensitive to the radiation. And my hypothesis is, I've seen this, that as the IT technology has increased, we are seeing a lot more thyroid issues. So you are constantly bombarding your thyroid with this low level of radiation. And I believe that is maybe one of the reason for the thyroid dysfunction. And so now you can ask me a question. So Dr. Sodhi, in today's world, we don't have any way out of this one. We cannot, we do have to have cell phones. We have to have these laptops and computers and stuff. Yes. So the best method for your cell phone is keep them away. Don't put close to your ear. Use a headphone or use a speakerphone. Whenever I'm talking, I'm using a speakerphone, so I don't have to keep it close to my ear, and that is very close to your neck, and you're directly exposing your thyroid to the low wave radiation. And similarly with your computers, you want to use a lead sheet which you can use underneath your computer. And lead lead sheet is available from hardware store. So yes, I know, a lot of people travel with the laptops and stuff. The lead sheet is pretty heavy, but if you have a dock, most of people has a dock where they work most of the time. So at your dock place, you just buy this lead sheet, put it underneath your computer, and it's going to take care of your radiation, low level of radiation. And another factor which you can also do is add more iodine rich food in your diet, so that is also going to cut down the effects of the radiation. Remember when the Chernobyl happened in Russia, and there was a lot of radiation exposure to people, and people who used iodine got saved. So the iodine is your savior. We have a product out there designed by me. It's called Thyro M, which has a 7.5 milligram of iodine, which is the average American need in a day. So most of us, we are not taking enough seaweed or iodine sources. We need that. So I encourage people to use that kind of source of iodine, to take a 1 pill a day, or add seaweeds in your diet every day. Then the other environmental factors are pesticide, insecticide. There are fire retardants, which has been sprayed on our clothes so that it doesn't catch fire. It was on our sofas, it's on our carpet, it's on leather, it's everywhere. And that fire retardant has shown to disrupt the hormones and also the thyroid function. So I worry about these young kids who are creeping and crawling on these carpets and the sofas, and because our skin is very porous, we just absorbs these things into our system, and sucking, and especially the poor kids, they are more exposed to this kind of stuff because he's constantly, rolling on this carpet. So that's why whenever a patient comes to me, I'm very heavy on getting most natural things. Carpets, take the carpets out, put hardwood floor, or put the throw rugs, which is not been sprayed with the fire retardant kind of stuff. The old-fashioned things would be much better here. And so if you follow these directions, I think you'll be able to cut down the stresses on your thyroid gland. Then there is a disease called Hashimoto. Dr. Hashimoto was a Japanese doctor who recognized this syndrome first. And so in the tradition of medicine, whenever a doctor recognizes a disease, that disease is named after that doctor, like Parkinson disease. Dr. Parkinson actually established it, although it has been established thousands of years ago in Ayurvedic medicine as a kampavat. Kampa mean you have that shivers in your hand, and what is the imbalance in the nervous system. But most commonly known as a Parkinson disease. Similarly, Hashimoto disease is an autoimmune disease where the thyroid is being attacked by your own body. And so we will talk about the testing and type of stuff as we go along with this one. The another form of disease thyroid is goiter. Goiter is, as I said earlier, is a deficiency of iodine. And I grew up in the mountains of Himalayas, and the most of the mountainous part of the world are low in iodine. And I used to see big, goiter enlargement on the thyroid. It's like a huge, almost like the size of apples, are even bigger than that one. And even certain villages will have, everybody will have that goiter hanging outside their throat. And these even people, the villages has been named after that goiter. And it's in Ayurvedic medicine we call it Gul Gund. Gul mean throat, Gund mean a kind of a tumor. So and they used to call that Gul Gund village. The people, everybody has that goiter disease in that area. And there was some jokes associated with that, because when you have that big thing hanging in your throat, you can't look down. You have a hard time looking down. But the jokes are aside, but it's a serious disease because of the deficiency of iodine. And since the government of India also made the regulation to put iodine in the salt, and that has cut down that disease drastically. And so that's a good part about it. But still, I see goiter here in America too. And in America, people are maybe not taking enough iodine, or their gland is not functioning properly. If your gland is not functioning properly, the thyroid gland, then you can also have a problem with it too. Hi, folks. Again, if you have any questions, you can call me at 844-301-1250. The number is 844-301-1250. And, you will be, I will be very happy to answer your questions regarding the thyroid diseases, or you're suffering with thyroid and not very satisfied with the results. I will be happy to guide you through that process there. Okay, so coming back to the Graves' disease, as basically is a disease of iodine deficiency, or the hypofunctioning of the thyroid, or even hyperfunctioning of the thyroid. So it can be both ways. Then there is a other form of thyroid disease which happens in pregnancy. Most of the time, the thyroid goes into hypofunctioning, and that can also cause problem with the kids. When people get sick, they have surgeries, or they have a trauma or burn, they can also have the hypofunctioning of the thyroid. It's a very common, anytime the body goes into a stressful situation, the body will go into a kind of change, and the thyroid is the most affected gland with these kind of stuff. So chronic infections, people who has been suffering with chronic infections, you will also see that their thyroid is not functioning properly. And sometimes they can also go into hyperfunctioning mode too. So what kind of testing we need to do for the thyroid? We will discuss that after we come back with this commercial break there.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Hi, folks. This is Dr. Sodhi again with your favorite show, Your Body's Your Natural Pharmacy, at Desi 1250 AM. And, I want to thank you because wherever I go in the community, or at the different get-togethers, people come forward and say, thank you very much for your wonderful show, and we are learning a lot. And I really want to encourage you to call us too, so that we know you really are there. Because a lot of times, when we don't hear that feedback on the radio, we assume that we are not getting the purpose done. And my purpose is education here. I'm not trying to sell anything. I'm just trying to educate people, because the health is a personal issue, and you cannot create health by just popping in a pill or a drug or even a supplement. You have to create a balance in your health. And this is my main focus for every disease, is how the body can heal naturally. Allow that healing process to happen naturally. And if you allow that process to happen, even you can reverse your cancers or thyroid disease or blood pressure or cholesterol or heart disease. Doesn't matter what disease you have. In my clinic for the last 36 years, we have thousands of patients from heart disease to cancers to thyroid disease, which has reversed their diseases. So we were talking about the testing. This is very interesting and touchy subject, because I see a lot of patients who has been to their endocrinologist, and the endocrinologist or a family physician has done the testing for thyroid, and most of them say, oh, your thyroid is normal. And when they come to me and I said, oh, your thyroid is not normal. So they are very confused. And even I've heard, in my colleague circle, especially the allopathic colleagues, says, oh, every naturopath diagnoses thyroid disease. And which is kind of a matter of laugh, because I think they are not looking at the whole physiology. And yes, there is a lot of people who has thyroid issues, and they are not looking at that as such. And I'm going to tell you why they're not looking at the whole picture. They're looking at only one number, and that is called TSH. We had talked about that already, thyroid stimulating hormone. And even with that one, if you have a range of close to 5, the highest normal is 4.5, they are still considering it normal. But the patient is saying, I'm feeling fatigue, I'm tired, I have a sleep issues, I have a dry skin, but you're okay. Let's check it out another 1 year. Again, the picture is similar or a little worse. So they are not properly treated, and when they're treated, they are given a T4 substitution, which is Synthroid or Eltroxin, which we're going to talk about when we come part of the treatment there. But that does not fix the symptom, because again, we are not looking at the whole picture. So what kind of testing you should do? So yes, of course, the TSH is very important, because TSH is the stimulation which your thyroid is getting from pituitary gland, and it wakes up the thyroid gland and releases the hormone, and then that hormone is active in your system. And what in turn, what it does, it releases your T4 and T3. And there is a long name, I think is not very meaningful for you to all to know that name, but for short, we can just remember T4 and T3. And even that is not measured by most of the doctors. Usually they do TSH and says, okay, your thyroid is okay. And as I said earlier, if you're a female who wants to get pregnant, and if your levels are low, below 2.5, you have more chances of getting pregnant. And if your level of TSH is above 2.5, if you're 3 or 4 or 5 or close to 4.5, your chances of getting pregnant reduces drastically. And in my clinic, we do it every day. We have patients coming from these fertility clinics, and they have done all the stuff. And when we fix the thyroid function less than 2, they exactly get pregnant very, very quickly. So that is another thing which you need to keep in mind. So then basically the thyroid disease is a disease of conversion of T4 to T3. The T3 is the very metabolically strong, almost 4 times more important or potent than T4. So what happens, you're not converting T4 into T3 in most of the thyroid diseases, hypothyroid diseases. And so if you're not measuring T4 and T3, that means you're also doesn't know. So what is T4 and T3? That's like you put your foot on the accelerator and the gas pedal goes on and your car speeds up. But you are putting your gas pedal to the full and your car is not speeding up. There is something wrong with that. So this is how the TSH is stimulating, actually releasing T4 and T3. So if your foot is full on the pedal there to the highest volume, you can say that, but then you're not making any speed in your car, there is something wrong. Similarly, if your TSH is very high and your T4T production is not coming up, that means there's something wrong with that. But there are other factors which are missing and which is not measured at all in a allopathic world. So most of them will do TSH. Few doctors will do T4 and T3. But there is another factor which is called a reverse T3. So reverse T3 is a hormone which resembles the T3. And when you're actually measuring T3, you're measuring the both T3 and reverse T3. So what it does, it hangs downside and dock on the receptors of the thyroid and makes your thyroid inactive. And so looks like there is a caller, and I will take this call. Just let me finish up this discussion on the thyroid test, and I will take this call. So basically, when you have this reverse T3 docking on, and the number of reverse T3 is elevated, then your thyroid is not functional even. So a lot of my naturopathic colleagues they measure this reverse T3. And other possibilities that you may have thyroid antibodies. And there are 2 kinds of antibodies which are measured. One is called TPO, another is called anti-thyroglobulin. So if you're not doing the whole picture, so that means if you're not testing for the TSH, T4, and free T3 and T4, not bound one, and reverse T3, and also the thyroid antibodies, you may not be knowing the full function of the thyroid properly. And if you don't know the full function of thyroid properly, you can't treat it, because the medication out there is just Synthroid or Altroxin or some form of T4. But that does not help the whole process there. The the other thing which is not measured and which is considered a hocus pocus medicine is the cortisol levels. And cortisols, if you measure in the blood, that does not give you any idea. So it has to be measured through the saliva, and you have to measure it throughout the day. And so then, if you're not doing that, the cortisol level, that does not tell you how stressed you are. And if you're under stressful situation, you are not going to have a normal thyroid. Another factor which is also ignored, and we are completely losing that, is insulin. So needs to be measured fasting insulin, or another test which I do is the A1C, which is the long-term blood sugar levels in your body. And so these factors, along with hormones, especially the androgens, the testosterone and females, and DHEA, the hormone binding globulin. And if you do all these things, now you're finding out the real picture about the thyroid. And depending upon that test, then you can treat it accordingly and then make the thyroid gland much better. So looks like we have a caller. Caller, go ahead. This is Dr. Sodhi. You are on show Your Body is a Natural Pharmacy. Who is this?
Yeah, Dr. Sodhi, this is Lucky Walia, and I have a question. I've been diagnosed with hypothyroidism for a long time, but I'm noticing that I do have an issue with hair loss and weight gain. And can you please guide me what are the things I can do? And have you heard of T3 treatment, and what is your take on it?
Yeah, no, very good question. See, I just answered some of the question already. So the one thing is, Mr. Walia, you have to check your thyroid stimulating hormone, which is important, but also T4, T3, reverse T3, thyroid antibodies, and the cortisols, maybe insulin, and maybe check your hormones, because as we age, the hormones are dwindling, and there is a hormone called serum binding hormone globulin, and if you have that higher, that also dampens your TSH activity. So it's a complex issue. It's not a very simple issue. But if you have the full picture, now depending upon what's going on with your body, you can help the body to get back to the normal. And it's very common. If you are treated with the, most probably, are you treated with the Synthroid or Altroxin?
I take levothyroxine, 150 micrograms.
Yeah. So So basically, what your doctor is doing is giving you T4, and T4 converts into T3. But if you have a problem converting T4 into T3, you will have all the symptoms because your body is not efficiently treating it properly. And so please keep listening to the program, because we will be talking some of the answers for you, and we will have lots of issues covered with my talk, because there is a wonderful description I've collected for you guys to listen to. And I think if you listen to the whole program, you will be able to get some idea. And it has to be comprehensive. You cannot just give you the levothyroxine or Synthroid only, because you're not doing the full. But when the body makes two hormones, T3 and T4, and T3 is the most potent hormone, and plus T4 converts into T3. So if you're not completely balancing the whole thing, the hormones, your insulins, your cortisols, you are going to have problem. And liver, the important function of liver is to convert the T4 into T3. So if you not have a bad liver, and most of us living in the society, if we like our martinis or alcohol, or eating too much carbohydrate, sugar, fried food, the packaged food, they all dampen your liver function, and that does not help your liver. Alrighty, so I hope this answers your question, and I have a second caller. I'm going to take this call again. So go ahead, caller. This is Dr. Sodhi.
Hi, Dr. Sodhi. This is Vibhuti. I was one of your patients on thyroid cancer,
Yes.
And I just wanted to share my story.
Yes, Vibhuti, thanks for coming on. Vibhuti, this is very brave of you to come on the radio and discuss your story, because a lot of people really are hesitant to discuss their stories especially on air, on television. And I really appreciate your effort to come on online. So can you tell what was going on with you and what happened to you?
So a year and a half I was diagnosed with cancer, and it was papillary kind of cancer. They didn't know if it was very aggressive or not. So of course they suggested surgery, and I was not really that the underlying cause is
Hello, Vibhuti.
just
Can you
variable
come on
thyroid.
landline because this looks like you're cutting off in between. So we are missing you,
Oh,
and I think you have a really good story there. So can you share it online, please? Come on
let me
landline
call you
because
back from my
you're
line.
cutting off.
Yeah.
Okay. Yeah. So I will continue in the meantime. When you come on, let me know. So basically, this Vibhuti is a patient of ours in the clinic, and she came to us with the diagnosis of thyroid cancer. And thyroid cancer has become very common, by the way. I don't know, either we are diagnosing more or we have a issue with the environment. And I believe there is a lot more issue with the environment. That's why we are getting thyroid cancer patient. The one good news about thyroid cancer is not the most aggressive kind of cancer. It does not kill very fast, and but still it has mortality attached to it. But if you diagnose it early and you treat it properly, there is a lot more survival. And so I think when Vibhuti comes back, we will listen to her story. And it looks like she is online again. So Vibhuti, welcome back.
Thank you.
So can you
So
can you
I was
can you
just
share your
saying,
story, please? Yes.
sure. I was just saying that once diagnosed, they wanted to go for surgery and radioactive iodine, and something inside me was not okay with both of those options. And I have little kids, so especially radioactive iodine was something um, my heart couldn't say yes to, because I knew whatever they say, whether or not I'm safe, but I knew I would be exposing my kids to the same thing again, which would affect their thyroid and their health. So I started doing research, and of course, Dr. Sodhi's name came up, but I still had to go for surgery. My family was more insistent on surgery. They were okay with not going for radioactive iodine. So I met Dr. Sodhi after my thyroid surgery. I think it was a month after that, and they were really insistent on radioactive iodine. So I met Dr. Sodhi, and Dr. Sodhi was kind enough to support my decision for not going with it, and we started the Ayurvedic way of modifying my diet, modifying the lifestyle, and going with some supplements to help my overall health. The other thing that really hurt me was the regular doctors here, especially my endocrino. They were not supportive of this, and they actually almost yelled at me for not going for radioactive iodine, which triggered a lot of anxiety. And then
Yeah.
I ran to Dr. Sodhi again, asking him for help, because, of course, it confused me. It put me to such anxious levels I can't even describe. And he helped me. He supported me. I think most of all, just altering lifestyle, going for panchkarma treatment, and following whatever he was suggesting helped me, and his encouragement throughout. So thankfully now I'm very happy with my decision. It's been 1.5 years now. My
And
last
your
results were
antibodies are also negative too. So which is the the measurement which you do even with the after
right,
radioactive treatment. So yeah. So actually,
right. So I
Vibhuti,
didn't.
one thing is when you're going through the treatment, I remember there was a lot of anxiety and you were very scared and fearful. So I encourage my resident doctor to do a lot of literature research on the subject to see if the radioactive iodine is 100% successful in treating. When we did the later research, we found out it's not. So that was the most kind of interesting for me. Say, wow, it's not 100% successful. The people still get thyroid cancer even after getting radioactive iodine. And so the decision was not made on the active science. It was made on something else, and maybe a financial stuff. So that's what was my concern. But so, wow, there is not even the research is not supporting that radioactive iodine is the only answer for this kind of condition. So do you
And
remember that?
that's yes, and that's true. We did research, did some research too, and I found blogs of people who had gone for radioactive iodine up to 3 times, and they had actually been to their lifetime highest levels, but their cancer was occurring back and back. So, yeah, it was something that I thought was not. It's and of course, Dr. Sodhi can explain in further details, but radioactive iodine not just spoils thyroid or cancer cells, it also spoils a lot of healthy cells in the body.
Exactly.
Plus, of course, you expose your loved ones with those
Yeah.
things.
Yes. Yeah. Well, you're walking like the radium stuff in your house, and especially the younger kids will be much more affected. So the one thing is, I don't know, because I believe that there is a body has the ability to heal, and which is true. But if you look at the normal physiology, we are always bombarded with a lot of stuff, and cancer is one of them too. Cancer is not kind of worst thing. We make everyday cancer cells. Everybody, me, you, and everybody else is making cancer cells. But if your immune system is stronger, it actually precisely target those cancer cells and kill them and get you rid of the cancer. So practically speaking, all of us has cancer cells, but now the number of cells can be 40, next day maybe 80, because if your immune system is not working, and next day maybe 160 and 320, and the computation goes for millions. And now you start to see a changes in the organ there, and that's when we start diagnosing it. And again, one other thing is, cancer is a gene disruption disease. Your genes, which are supposed to do a normal functioning, normal physiology, it does not function normal physiology. And the radioactive iodine or radiation or chemotherapy actually destroys more gene behaviors. So that is another thing. And again, I'm not against using chemo or radiation treatment, but if I'm looking at it, that overall survival, if with this particular treatment, is you are having a, say, normal living style after that, I'm okay with it. But if you have a high mortality, if you have a less survival, and if the normal treatment is as good as non that treatment, I'm going to go for that. But again, I think it's a personal choice. So how you been feeling now? Are you feeling better? Are you feeling more energetic? Because I know you're into gardening. You have brought some seeds for me too, and we share the love of gardening together. And so can you tell us what is your life look like these days?
It's wonderful. It's actually better than what it was. I never realized before that I was so fatigued, because when it's happening every day, you don't even realize the difference. But I feel wonderful now. All my anxiety is gone. My results look awesome. And yeah, I'm able to follow my hobbies, that is gardening, biking, hiking, not as much, but yeah.
Can
So
you share
yeah, I'm
the
able to
last
do
visit you
everything.
have with your endocrinologist? You said something to me. Can you share it on air too?
Sure. So the endocrino ran all the tests, and she was actually very surprised with how good the results were. And she kept thanking. She knew I'm going through a naturopathy treatment, but she kept thanking God and surgeon. She was like, the surgeon did a beautiful job. That's why there are no recurrences. And we can wait for your radioactive iodine for another year. You don't even need a scan. So she didn't even go for an ultrasound, which was due after 1 year of surgery. She said we don't even need that. So that was really positive. And
So
she didn't mention a word about radioactive iodine or anything, and how it was a bad decision to not go for it.
yeah. So the thing is, most of the folks which I see, I like to, whenever I treat a patient, I like to create a team, and your endocrinologist is an important part of our team, because thus he is very well trained in endocrinology, better than me. But when it comes to treatment part, sometimes I don't see the same level of confidence which they see in their treatment. But I think if he is on our team, we can certainly see if something goes wrong with you. So that, because same thing which I say to my cancer patient, other cancer patients too, because we want to create a teams, and everybody's looking at you and helping you. And I see my role as a coach, because your body is what heals. I'm not have the healing power. You have the healing power. What you do to make the difference is your nutrition, your stress reduction, proper sleep, proper exercise, and all those factors help you heal fantastically. I really thank you, Vibhuti, for coming on the air and sharing your wonderful story. I think it will be a lot of inspiring for a lot of the people out there who can really look into that. There are other options available for them if they want to do it. And but one thing is, if you have a confidence, then do it, because if you don't have a confidence, you are going to go back and forth, and that's not going to help the whole process. I really want to thank you,
Thank you,
Vibhuti.
Dr. Sodhi, for giving me a chance. Thank you
Yeah,
again.
you're welcome. Take care. So, okay, we had this wonderful story from Vibhuti. Looks like we had a lot more to cover, and maybe we have to do a second show on thyroid gland too, because the time is just flying by here. So now, there are lots of stuff which you can do to avoid the hypothyroidism function. So if your thyroid is already kind of borderline and you are taking these kind of stuff, it will push you towards hypothyroidism. And one of them is the broccoli family. So like cauliflower, lettuce, and mustard greens and turnips, bok choy, they are good food, but if you have a hypothyroidism, they may not be the best friend. So I don't really stop them. I said, okay, reduce those goitrogenic, these food once a week. So that doesn't mean one day a week you can have broccoli, another day you can have cauliflower, other day you can have turnips, or other day you can have bok choy. All those group, just keep them once a week. But then other things you can be, doing that too. Looks like we have another caller on the line. So caller, go ahead. This is Dr. Sodhi with Your Body's a Natural Pharmacy.
Hi, Dr. Sodhi. This is Arun.
Hi,
I
Arun.
want to understand something about hypothyroidism. So you mentioned that T3 hormone plays a much important role than T4, and its precursor is T4.
Yeah.
And for treatment, I'm hearing doctors prescribe some form of thyroxine.
Yeah.
And I'm wondering why not a T3 then? Is T3 not available in a shape that people can consume? Why T4 is given when T3 is the one?
It's available and it's given. There's a drug is called Cytomel, or T3 is also compounded. But the problem is it's not very stable. So that's the issue. So it's not very stable hormone. So you can actually there is a protocol which a lot of my colleagues use, and I did not see any much benefit, so I stopped using it. It's called Wilson protocol, where you actually treat with the higher doses, increases doses of T3. I have done it in a few patients. I didn't see the results, and other people, may use it. But since I didn't see the results, I stopped using it. So, but you have to see, because there is a conversion issue, and the conversion, you need to see what is blocking that conversion. So it can be your liver, it can be your obesity, it can be your hormones. You may not have enough hormone. And I mentioned there's a hormone called serum binding hormone globulin. If you have excessive amount of that, that also interferes with the function of. So this is a complex issue. It's not a simple issue. And that's what I see. Majority of thyroid patients, they still have heavy weight. They are not functioning properly. Their skin is still dry. They are still feeling fatigue, although your TSH looking normal. The TSH is looking close to 2, but they say, God, I'm still fatigued, because you're not focusing on so many other factors. And if you're not sleeping at proper time. And an interesting thing is with the thyroid diseases, when you have a stressful situation, these folks will wake up 2:30, 3 o'clock in the morning. And because at that time, the cortisol levels are the lowest. And so if you don't have enough your adrenal function properly, which is another kind of put down theory in the mainstream medicine, they don't even consider that there is a dysfunction of adrenal glands, which is very commonly used in my world, in naturopathic medicine, in Ayurvedic medicine, that adrenal glands are not functioning properly. And so when you have a improper function of your adrenal glands, you're also not going to help the whole process. So I hope this answers your question. But it's a complex issue, and it's not easy one. But you have to look at the whole aspect of it, and then you get the things done more properly. Thank you for coming online, please.
Okay.
So as we discussed, so the broccoli family, and another which can bother is the nightshade family. So nightshade family is the potato, bell pepper, tomato, eggplant, your favorite jalapenos. So those are nightshade family. Again, if you have the thyroid issue, maybe you want to limit it or avoid for some time and then see what happens. And you should work with your doctor regularly. One other thing which I suggest for the thyroid disease is get your level checked more frequently, because I see patient in my clinic, and even in spite of my insistence that you should come at least once a month in the beginning and maybe every 3 months after that. Because what I've seen is, because I've been in the business for 36 years, and it's so interesting that the thyroid glands going up and down, is waxes and wanes, go up and down. And if you're not properly keeping your values in the normal ranges, you are not going to have a really good values out there, and your thyroid will be not function properly. So I think it's important that you keep on top of it, keep talking to your doctor. And if you're not satisfied, find somebody else, maybe go to some naturopathic doctor who can help you. The another one, which is a very common, especially with the Hashimoto and the autoimmune kind of thyroid disease, is a gluten sensitivity. If you have a gluten sensitivity, your thyroid will play havoc. And the majority of people will have a thyroid issue and a gluten at the same time. So sometimes I tell my patient, lay off the gluten. And gluten containing grains are wheat. And if you are Punjabi like me, and if you tell a Punjabi that don't eat roti, he'll be ready to kill you, because Punjabis love rotis. But the problem is the rotis are not loving you guys. Okay, so if you are eating the rotis, your thyroid is going to have problem. And so the gluten sensitivity has increased. I think this is also thanks to the farming practices which we have, may have caused some of the things. A lot of folks who ate the gluten containing grains like barley and wheat and spelt and kamut and rye, they did not have problem previously. I believe this is to the chemicalization of these crops, which has created more problem there. So basically, look at if the gluten is the problem. And sometime if there is a test available which you can check the antibodies against gluten sensitivity. And sometimes that doesn't show up, but then there is a food allergy testing or food sensitivity testing, which is also helpful. So now coming back to what treatment options are available for the hypothyroidism. So the regular treatment is Synthroid or levothyroxine, which is a T4 treatment. And the substitution is very common with this disease. But the problem is, it's not what your body is making. Your body making T3 and T4. So most of my naturopathic colleagues, and including me, we prescribe the natural thyroid, which is the animal origin, and which has both T3 and T4 in it. And so depending upon your thyroid and TSH value, it can be given in different doses. But again, there are other natural ways of helping your thyroid is a seaweed. So I encourage people to consume more seafood. Sorry, not seafood, the seaweed in their diets, and the other iodine containing food. Exercise is very important to help your thyroid gland too. If you walk, it helps you. If you do some lightweight training, it helps you. And also, I encourage people to do yoga. And there are special changes in the yoga postures which you can do. One of them is a shoulder stand or cobra, because when you doing the shoulder stand, you're pressing on your thyroid, and when you do cobra, you're extending your thyroid gland, and that helps to activate it. And so I encourage one breathing exercise where you are putting your chin to chest and you breathe in slowly, fill your lungs to a full lung capacity, and then extend your neck all the way back and release it. So all these glands, they are tissues. Like heart is a tissue, lung is a tissue, muscle is a tissue. And when we exercise a tissue, we actually activate the function of those glands properly. This is a natural way of bringing that gland to normality. And sometimes I also encourage people to do hot and cold. So 30 seconds of hot and 30 seconds of cold. You can have an ice bag, a hot pack, and you can watching your television or some of your favorite show and doing for 5 minutes of that. And nothing bad. It's a non-toxic medicine. It's a free. You don't have to spend money on it. It's a wonderful way of stimulating your thyroid again. And there are some herbs which you can also use for helping the thyroid. And the one of the herb which is my favorite, is ashwagandha. And ashwagandha can be actually used for both hypo and hyperthyroidism. Another one is bacopa. And again, this can be used for hypo and hyper. And the another very famous herb in Ayurvedic medicine is kachanar. And there's a preparation called kachanar guggul. Guggul is also used for thyroid. And that's what I put when I designed ThyroM. I have the kachanar and guggul and bacopa and ashwagandha and other things in it. And iodine is very important. Iron is very important, by the guys, because the iron, if you have low iron, and the selenium is also very important. And for selenium, you can get Brazil nuts. So looks like we're running out of time pretty soon here. And thanks for coming on the show. We had good calls, and Hopefully, you enjoyed this show with the thyroid. And thanks very much for this wonderful show and giving me opportunity to be on the radio 12:50 a.m.